Hello friends, welcome to my channel Homeopathy World. I am Dr. Samina and in today's video we are going to discuss the second aphorism from Organon of Medicine in detail. In case if you have missed my video of explanation of first aphorism, check out the I button on the right hand of your screen which links to the Organon of Medicine playlist. Also, if you are new to my channel, click on the subscribe button, and if you are already a subscriber, make sure you have clicked the bell icon so that you get the notification on our latest updates. Especially because coming weekend, I'm gonna host an awesome giveaway for my 1000 subscribers. Stay tuned to know more about the giveaway by clicking on the bell icon. So without further ado, let's get started. As we already know that the second aphorism states, the highest ideal of cure is rapid, gentle and permanent restoration of the health or removal and annihilation of the disease in its whole extent in the shortest, most reliable and most harmless way on easily comprehensible principles. In the first aphorism, Hahnemann discussed the mission of the physician, that is to cure. And at the same time, he gave a very brief and to the point definition of cure, that was to restore the sick to health. In the second aphorism, Hahnemann goes ahead and qualifies the best possible cure. He was not satisfied by just telling us what the cure is. In the second aphorism, he very clearly states that the ideal cure should be rapid, gentle and permanent. We have already discussed in aphorism 1 that only when there is restoration of health, we can call it cure. Now, let us discuss what qualifies as an ideal cure. So, the first qualifying factor as an ideal cure is rapid. The ideal cure should be rapid. As an adjective, rapid means moving, acting or occurring with great speed. It is synonymous with fast. So, the ideal cure should be fast. The ideal cure should take the least possible time. But there is no ideal time for ideal cure. It totally depends upon an individual case. And it is not up to us to decide what would be the ideal time for curing a particular case. Our efforts should only be directed towards curing the patient as early as possible. The less time it takes to cure the case, the better. We now move on to the next point, that is gentle. The ideal cure should take the least possible time, but it should not be harsh. Gentle means not harsh or not severe, mild and soft. So the ideal cure should not just be rapid, it should also be gentle and soft. It should not be harsh or damaging in any way. Let me give you an example. It is our duty to relieve the patient of his sufferings as soon as possible. Similarly, in an effort to cure the patient quickly, if the patient suffers in any way with a strong homeopathic aggravation or new medicinal symptoms or any kind of suppression, even then the condition is not ideal. So, for a cure to be ideal, there has to be a balance between the rapidity and the gentleness. But even when you have given the simillimum, you might not be rapid enough or gentle enough in curing the patient. How is it possible? If the potency is lower than the required potency or the repetition is not frequent enough than desired, you are not going to reach the cure as rapidly as is possible, and also it is going to be more harsh on the patient. In the same way, if you give potency that is higher than required or too much repetition of the medicine, your cure will be rapid but not gentle enough. Plus, there will be more homeopathic aggravation and there is even an increased risk of idiosyncratic reaction to the remedy by the patient or lifelong imprints of the medicinal symptoms in the patient. So, your work does not stop at choosing the simillimum only. You have to select the right potency and also the right repetition and then manage a case properly to effect an ideal cure, which is rapid as well as gentle. Now we come back to the next term, that is permanent. Permanent means lasting or remaining without essential change, that something lasts forever. So, once you restore the health, there should be no relapse of the condition. If you relieve the patient of all his complaints, but the complaints come back after some time with varying degree, then it is just palliation and not cure. The whole conventional medicine is geared up on palliation and suppression, and this focus on cure alone puts homeopathy in a different stream of medicine. But what do you mean by permanent restoration of health? Does it mean that once you cure a person, he or she will never fall sick again? Or once you cure a person with depression or ovarian cyst, she will never catch a flu again? Or once you cure a person in a flu, he will never get flu again in his life? No, that's not the correct meaning of cure. Even after you cure a person, the person may come down with occasional acutes because even relatively healthy people can catch flu sometimes. However, they usually resolve quickly without any complications. Another related question is permanent cure. What is permanent cure or unconditional cure? To answer this, we first need to understand the difference between relapse and recurrence. If a disease condition comes back soon or annually after stopping the treatment, then it is most likely a relapse. If a patient says, "Doctor, I was better while I was taking medicine. I even stayed well for a few days after I stopped the medicine, but now I again seem to get all symptoms back," it usually means that the medicine just palliated the case and the cure was not complete. Therefore, it is just a relapse. While under the treatment, the patient improves physically, mentally, and emotionally and stays that way for a very long time. It is an usual indicator of cure. If you cure a person with malaria or typhoid and next year the person comes down with it again, it does not mean that you did not cure the patient or the cure was incomplete. An acute infection usually depends not only on the vitality of the person but also on the virulence or the strength of the virus. So if a virus or bacteria is too virulent, anyone can come down with a sickness, even the healthiest person on the earth. So same goes for chronic illnesses. Chronic illnesses are usually precipitated illnesses from chronic stress or emotional imbalance. After you cure a person, it is a person's responsibility to maintain his health. If the person again starts taking unhealthy diet or adopts an unhealthy lifestyle or comes under similar mental emotional influence or stress which was initiated during the disease process, he or she may have a recurrence of similar condition. So, the cure is not unconditional. Once the health has been restored, it is the patient's responsibility to ensure that the state of health is maintained, and the cure is never unconditional. Now we move on to the next part, that is annihilation of the disease. Many people will say that while Hahnemann was speaking about treating diseases, he did not mention about the holistic approach or individualization. But Hahnemann always puts importance at just the right places. What is this whole extent? Annihilation of the disease in its whole extent. For Hahnemann, disease was not an entity, it was a process. And curing a disease means reversing the whole process in such a way that not just the infection or the pathology disappears, but the patient gets back to his or her own optimum health. Hahnemann has used another set of words to jot down the idea of ideal cure, like shortest, reliable, and harmless. Shortest is synonymous with rapid and as such needs no further explanation. Most harmless or least disadvantageous stands as clarification for gentle, but the words most reliable seem to be different. What does reliable mean? Reliable means trustworthy, dependable. When does a person or an object becomes reliable? When you know that it will not fail. In homeopathic terms, it means that the cure will be reliable if there is no relapse, if you can trust the medicine to work and will give the patient no relapses. So reliable is also used in a sense similar to permanent. But reliable has another dictionary meaning that means yielding. That means something which yields result. Something which is proven with clinical experiments or statistical data. So if we extend the definition of reliable here, we come to a conclusion that the cure should not just be permanent. It should be done through a mode in a way which is reproducible too. Reliable in a way that it will yield the same or compatible results in different clinical experiments or statistical trials at different times. So this qualifies an ideal cure. Now we come to the most complicated part of this aphorism, that is on easily comprehensible principles, or according to clearly realizable principles. What was the need for this? Here, Hahnemann was not just thinking about curing a patient. Here, he was widening the scope of his words to cover all the patients, all the homeopathic patients, and his last words of this aphorism reflect his thought about homeopathy as a system. For him, medicine in general and homeopathy in particular was not just an art, but also a science. Every science is based on certain rules, law, and principle. Without any set of rules, there cannot be any uniformity or standards, and there can be no reliability. Hahnemann wanted that the benefits of the real medicine should reach each and every homeopathic patient, and for this to happen, there has to be some set of rules that everyone can follow to achieve cure. But why should there be these principles which should be easily comprehensible? Think of it in this way, that if there are few doctors in the world, as there are astronauts, astrophysicists, marine biologists, or nuclear scientists, what would be the state of the medical system? Would medicine and cure be within the reach of everyone? I guess no. The principles have to be such that these are easy to understand, and only then there will be mass proliferation and the benefit of homeopathy will reach each and every human being on earth. So that is the complete need of comprehensible principles, and that is how homeopathy will reach to each and every patient. So this was all about the explanation of the second aphorism of Organon of medicine. I hope this video was helpful to the students who are in BHMS second year, who have just started with Organon of medicine. And if you have any doubts regarding this aphorism or any other aphorism, please mention in the comment section below. Also, I'm going to explain these aphorisms in a serial order. So if you have any special request on which aphorism you need to be explained in detail, please mention in the comment section below so that I can explain that aphorism before the other aphorisms. So that was all about today's video. Thank you for watching. Please don't forget to subscribe to my channel and click on the bell icon to get the notification on our latest updates. Thank you for watching.